Mom couldn't stop screaming when she realized what she gave birth to. Her doctors believe the Texas girl is the most premature surviving baby ever reported. Her case means they can no longer say death is certain for babies delivered at 21 weeks gestation. Also, if you have not done so already, please subscribe to our channel and click that notification bell to get inspired by these real-life stories every day. Now, back to the story. Courtney's previous pregnancy with her son Hayden, now 5, had gone so smoothly that her second pregnancy was not considered high risk until her 20-week ultrasound, when her obstetrician gynecologist, or OBGYN, examined her and discovered that her cervix was 2.5 centimeters dilated, something that doesn't occur until the 9th month of pregnancy. She was sent to Methodist Children's Hospital in San Antonio for a couple of nights of observation and bed rest, but was eventually sent home. Courtney said that for the next week and a half, she felt so weak she couldn't get up. It was when she was 21 weeks and 4 days pregnant, when she was going to the bathroom, that she started feeling off. Something didn't feel right, so I reached down and the baby grabbed my finger, she said. Luckily, my OBGYN was on call that night, so they rushed me into delivery, and within 10 minutes, she was born. Stensrud went into early labor after experiencing premature rupture of membranes and chorioamnionitis, an infection of the placenta and the amniotic fluid. Baby Lila was born in July 2014, weighing 410 grams or 14.4 ounces, just 2 ounces more than a standard 12-ounce soda can. She measured 10 inches long, about the length of an envelope. The 14.4-ounce baby, who was lying on her stomach, still attached by the umbilical cord, was due in November, but it was only July. It was shocking to see a living, breathing person that small, she recalled. When Lila was born, she gave a faint cry but wasn't breathing properly. Obstetric and pediatric societies recommend against trying to resuscitate such small infants, the pediatrics paper explains. Such efforts may be considered futile or not in the best interests of the child because it's extremely rare for babies born this premature to survive without significant neurologic consequences, the American Academy of Pediatrics notes. So, when Dr. Kashif Ahmad, a Mednax-affiliated neonatologist at the hospital and lead author of Courtney's case report, entered the delivery room, he initially counseled about the baby's dire prospects. Infants delivered before 22 weeks gestation are too premature to survive. Their lungs are so underdeveloped that it's near impossible to deliver oxygen into their bodies. Even at 22 weeks, breathing tubes may not be small enough to fit into a preemie's airway, and ventilators may not provide enough breaths for their tiny lungs. The blood vessels in their brains are so fragile that they're prone to break and cause large bleeds into the brain, Ahmad said. Stensrud stated that while she was still in the antepartum room at Methodist Children's Hospital in San Antonio, Texas, she searched online for other moms who delivered at 21 weeks. There were reports of 22 and 23 weekers, but nothing about 21 weeks. So I knew there was minimal to no survival or viability at that point. But when I was holding a live baby in my arms, I just absolutely thought she could survive. I felt it in my heart. As he was basically telling me there was nothing they could do, I said, "Will you try?" Stensrud said. "If you would like us to try, then I'm absolutely happy to try," Ahmed responded, knowing that there were no guarantees. Then they took her to the NICU and doctors clamped the baby's umbilical cord. He placed her under an overhead warmer to raise her body temperature and placed a breathing tube into her airway. From that point, she gradually responded. She turned pink. Within a few minutes, she began to make efforts to breathe, and then she began to move, he recalled. Lila was on mechanical ventilation for 56 days. Doctors tried to extubate her twice and failed, but they succeeded on the third time, and she graduated to a nasal cannula. Courtney says that although her daughter needed prolonged care while in the NICU, there were 3 main health issues Lila faced: chronic lung disease, she was on IV fluids until she could start milk feedings, and early-stage retinopathy of prematurity, or ROP. ROP is an eye disease affecting premature babies who have received intensive neonatal care, particularly oxygen therapy, due to the premature development of their lungs. It is believed to be caused by the disorganized growth of retinal blood vessels, which can result in scarring and retinal detachment. At 3 months old, Lila was given shots of Avastin, a cancer drug that has been shown in clinical trials to regress the disease. Courtney said she made the 25-minute drive every day to the hospital to visit her daughter in the NICU. "I didn't skip a day. I was there morning to night every single day," she said. Her husband, Paul, visited every day for the first 2 weeks, but then he had to return to work, after which he visited every night. Finally, after 126 days, weighing 5 pounds and 8 ounces, Courtney and Paul were able to take their daughter home. She spent about 4 months in the hospital and was taken home 3 days before her original due date in November 2014. It seemed that was all, but no, we had at least one doctor's appointment a week for the first years, and that's difficult as far as scheduling feeding times and nap times around that, said Paul. However, Lila was never readmitted to the hospital, and Courtney says they knocked off the number of specialists she needed to visit one by one. By age 2, despite being smaller than other children her age, she received scores on Bayley-3 tests that were equivalent to those of a 20-month-old, the report says. The Bayley-3 tests are a standard series of measurements that analyze cognitive, motor, and language for children up to 3 years old. It was encouraging to see at that age. The ultrasounds at the hospital before she went home did not show injury to the brain. More than anything else, the Bayley tests confirmed what we were hoping to find. The report notes that Lila has not developed any auditory or visual impairments or cerebral palsy, which preemies are at especially high risk of, said Dr. Ahmad. Courtney says her daughter's growth has been steady and that her social development has improved. She's a typical toddler who loves climbing on her brother, playing one-on-one, by herself, or in a group, and she interacts well with the other kids, she said. However, Lila does have a speech delay. She's not really wanting to say her full ABCs or count to 10. Sometimes she'll skip a few letters. Despite that, today, she's happy, full of energy, and full of life. And keeps right up with her 5-year-old brother, Stensrud said. A 2015 study published in the Journal of American Medical Association found that survival rates of preemies have increased between 5 and 9% in the last 3 decades due to improvements in neonatal care. Infants born between 22 and 23 weeks gestation have about a 75% chance of survival without severe impairment. However, babies born at 22 weeks have about a 23% survival chance, and 2/3 of survivors did not have a severe neurodevelopmental impairment, the report says. So, indeed, Lila surviving her birth despite the complications associated with being born before 22 weeks of gestation is a miracle. However, people need to be very cautious about concluding from a single case that routinely resuscitating babies born in the 21st week of gestation is the best approach, Ahmad warned. Don't assume one positive outcome will be the outcome for other infants. At this time, resuscitating infants who are born in the 21st week of gestation is not standard practice anywhere in the world. Even for those infants born in the 22nd week of gestation, there continues to be significant disagreement regarding the best course of action due to the high mortality and substantial risks for long-term disability, Ahmad said. They told her that her premature baby died. A Utah woman who unexpectedly gave birth on a cruise ship months before her due date says she wrapped towels around the 1.5-pound boy with the help of medical staff in a desperate effort. Emily Morgan of Ogden said Thursday that until the ship reached port, she didn't expect her son Hayden to live. But thanks to strong lungs, a makeshift incubator, and an early arrival in Puerto Rico, the baby made it. He's now receiving care at a neonatal intensive care unit in Miami. Hospitals vary widely in their care for premature babies. Morgan, age 28, said the baby was due in September, but contractions began on August 31st during a 7-day cruise on the Eastern Caribbean. Morgan said her doctor approved the cruise to celebrate her daughter's 3rd birthday. Morgan said the pregnancy had been uneventful, so she was shocked when the contractions began just past the halfway mark of her pregnancy. She thought it might be false labor. Strict bed rest is not recommended as much. She and her husband called medical staff when they saw blood. A doctor aboard the Royal Caribbean ship told her she couldn't give birth because they were still 14 hours from the nearest port in Puerto Rico. But holding back was out of the question. Morgan said, "I knew the baby was coming." She said woman 20 suddenly wakes from a coma and is told she had a baby after the delivery. She said the doctors told her she had miscarried and she would get some rest, but she insisted on seeing the baby. About 40 minutes later, medical staff said the baby had survived but wasn't expected to live long. "I'd felt him kicking. I felt the process of him getting bigger." She said, "I'm going to see him. I didn't care if he's alive." Kristen Jordan's tiny miracle baby shows there's always hope. They brought her her newborn son, who was wrapped in towels wet from birth. He was wearing a tiny oxygen mask on his head. She said, along with his healthy pink coloring, it was a positive sign that his lungs were relatively strong as the hours went on. She insisted he'd be wrapped in fresh, dry towels, and she helped staff tuck microwaved saline pockets around him to create a makeshift cushion. In the incubator, they used a sanitary napkin to keep his head warm and tried to avoid touching his sensitive skin. Meanwhile, the captain was speeding the boat to Puerto Rico. and it arrived about 2 hours early. It was none too soon that black spots were starting to appear on Hayden's fingers, indicating his circulation was beginning to fade. 2 ambulances rushed the family to the hospital, where they were transferred to a children's hospital in Miami. Morgan said Hayden is making good progress. He's being fed breast milk through a syringe into a tube in his stomach, 2 tablespoons at a time over the course of 90 minutes. He's expected to be hospitalized until December 19th, though they're hoping he'll be strong enough to return to Utah at the end of October. KSL-TV in Salt Lake City was the first to report on the birth. I saw her properly 12 hours after she was born, and she was so perfect and so beautiful. I felt full to the brim with love as our journey carried on. We had ups and downs when I first held her at 25 days. At 3.5, it was the best day of my life. I still never dared to think we would ever take her home. I felt and still feel guilty that she had all that pain. Her life is and will be affected by being born 3.5 months early, of the pain caused to our families, of the stress I caused work after leaving one Friday and not coming back for 14 months. I wouldn't change anything because Layla is perfect and she is who she is because of what happened. She's feisty and strong and won't let anyone tell her she can't do something. She's taught us to be strong, to be together, and to be more than the sum of our parts as individuals. If you enjoyed the video, kindly give it a thumbs up, leave a comment in the comments section, and share with others. Thanks for watching, and catch you in the next one.